Already good number of questions in the chat box.
Yeah, I've got it. I will ask you those questions.
Sure.
Okay.
Sure.
Okay. All right. IT, I'm going live. Okay, fine. I think they have gone live. It's all. Recording is starting.
Sir, हम लोग live है sir.
Namaskar. This is Dr. Alok Roy from Medica Group of Hospitals. We bring compliments from Medica, and our responsibility is not only in the hospital. We want to go beyond. We want to reach you. We want to tell you a few things, how to stay fit, how to stay better, how to stay healthier. And in that series, every week, every Saturday, between 5:30 to 6:30, we bring you this webinar. In the beginning, we talked about third wave. Then we talked about winter and lungs. A lot of small tips our doctors provided to you all. And then last week, we talked about the winter and brain stroke. This time, we're talking about chest pain. Should you worry? One of the, probably the commonest cause of declaration on death certificate is cardiac arrest. Normally, most time we write cardiac arrest. The patient died off. That means that when the heart stops, you are truly dead. And heart stops functioning well before you're born, till the last breath, till the last beat. Breath stops. Once the heart stops, breathing stops. You'd be surprised how many patients we get every month who are brought dead to the hospital. If you leave aside those who are suffering from chronic ailments like cancer and other debilitating diseases, other than them, most of them die of heart stopping at home or while they were bringing them to the hospital. A lot can be done. It's not that heart stops suddenly all the time. No, there's good information, good symptoms. It complains for a long time before it finally gives up on us. So this small webinar for an hour, we'll try to wrap it up sharp by 6:30, is to bring you some information. What is chest pain? What causes it? I have with me Dr. Arindam Pande, who is our senior consultant, cardiologist, a very young, very dynamic, a very good cardiologist who will be associated with us for many, many years. I bring this webinar to you all in association with Bengal Chamber of Commerce and Rotary Club of Calcutta, Aviana. These two people are our supporters. They take us to you. And with this, I bring you to today's topic of chest pain, should you worry? I have Dr. Arindam Pande. Dr. Arindam Pande, over to you.
Thank you very much, sir. In fact, at the onset, I'd like to thank you because of bringing the very important topic of chest pain, because we do have multiple confusion, miscommunication, misconception, etc., regarding our chest pain. And yes, it is always some worry behind whenever we do have some kind of chest pain in any of the family member or ourselves. And because of those misconceptions, many a time we do actually wrong things which are not supposed to be done. So today I'll try to elaborate what exactly is the pattern of chest pain which are not good for you, because all the chest pain, they are actually not indicating some serious cardiac illness. In fact, if I start from front of the chest, there is skin, then there is subcutaneous tissue, bones, which forms the structure of our chest. Then there is nerves, vessels, the lungs, cover of the lung, which is very common site of chest pain origin. Then we do have heart, the cover of the heart. So all the structure which I mentioned, if there is some problem, there can be chest pain. So there are many reasons of chest pain, but all of them actually do not indicate some serious cardiac illness. Why it is very important to understand whether your chest pain is related to your heart or not, because it is the heart As Dr. Roy mentioned clearly, if your heart is beating, then you are alive. If your heart stops beating, then actually you are dead. So it is very important to understand whether your chest pain is actually arising from your heart or not. Because rest of those reasons which are not arising from your heart, you'll get good amount of time to settle that. And even if the chest pain is persisting, which is non-cardiac, then it is not going to give you, good amount of trouble in future. So jokingly, many a time we say, fastest way to get attention in emergency department of any hospital is to utter the word chest pain. Because nowadays, in the era of COVID pandemic, the emergency department of all the hospital has become very, very busy. So if you just go and say I'm having chest pain, you will get more attention. Why? Because all the physicians, the emergency consultant, the healthcare personnel, the nursing staff, brothers, they understand the meaning of chest pain. And some of the chest pain can actually indicate that you are suffering from something called heart attack, which is not a good thing to have. So here I am to discuss about the chest pain, the different types, and what are the types of chest pain, what are the associated findings which should make you cautious that you should not probably ignore it, and how you should approach a chest pain in your home. Now, many a time our patient, they complain of fleeting type of chest pain, burst of chest pain, which happens immediately. A terrifying two-word combination which comes to our mind is heart attack. Now, some of the chest pain symptoms, while scary, alarming, it may be unrelated to your heart, as I already mentioned, while some of them, even if they are very mild, can actually indicate some serious consequences. So I'll briefly discuss what are the pattern of chest pain you should understand clearly is arising from your heart. So how to recognize whether the chest pain is serious or not. Now, there are some features. Say, for example, if the chest pain is lasting only for a few minutes, so short lasting chest pain, this generally is very, very benign type of chest pain. They are actually, majority of the time, do not indicate serious cardiac illness. Now, if your chest pain is accompanied by other symptoms, say for example, shortness of breath, sweating, nausea, fatigue, or reeling of head, those chest pain can actually indicate some serious cardiac, problem in your heart. And if your chest pain have some special character, say for example, there is some radiation, say for example, your chest pain is arising somewhere here, then it is getting radiated to the arms or back, jaw, neck, upper part of the stomach, or middle part of the back, that can indicate that this chest pain is actually angina. And as per the location of the chest pain, we have actually, this is a very beautiful pictorial representation where the cardiac chest pain can be. It is mostly in the upper chest pain. We call it central upper substernal chest pain. Sternum, the front bone, the bone which is lying at the front of your chest wall. So if it is there behind this sternum, we call it substernal. And you'll be surprised to know many of the chest pain or cardiac chest pain actually is not a chest pain. It's like a compressive feeling, sort of compression, which kind of radiate toward the inner part of the arm, the jaw, the back side, neck, and interscapular region. If your chest pain is having this kind of compressive nature and this particular pattern of radiation, it can indicate a cardiac origin chest pain. Now, what are the pattern of chest pain which actually suggest this is something else? It is not your heart. I already mentioned, if the chest pain is not a very long-lasting, short-lasting pattern of chest pain, and very importantly, if you can pinpoint the chest pain, so you can actually localize the chest pain. So in our field, we say if you can localize your chest pain, it is seldom cardiac origin, because cardiac chest pain you will never be able to localize with your tip of finger. So if you have something kind of pinpoint chest pain, it is mostly non-cardiac chest pain. Similarly, if your chest pain or chest discomfort, it lessens with exercise, actually it points towards something else. It is not likely to be cardiac, maybe gastrointestinal, commonly gastrointestinal. So if you're having chest pain which increases while you are walking or taking something in your hand, then it indicates it is cardiac in origin. Now, another reason your chest pain may be happening because of anxiety or panic attack. So we must see, we should try to evaluate the surroundings. If you had kind of bad mental status or something, some family member of you has some, died or something like this happened, then it also indicates it may not be something serious with your heart. So all the time we want to say, whenever you are having some chest pain, we must understand whether it is cardiac or non-cardiac. Because if it is non-cardiac, you do have plenty of time in your hand to evaluate it, to get it treated. But if it is cardiac in your origin, then we call it time is muscle, because then becomes very important to give proper importance, and time becomes a very vital factor. So before we understand further the cardiac chest pain, we will briefly discuss few words regarding our heart. So what is heart? As you all know, heart is the pumping machine of our body. What it does, it actually pumps, it receives the blood from the body, then it pumps it out to the different organs of our body. So this is basically a muscular organ, and it has a pumping beat. That means it beats 60 to 100 times in a minute. And while doing so, it pumps nearly 5 liters of blood per minute to different organs of our body. Now, as I mentioned, this is the muscular organ. So obviously, this will also need some supply for itself. So it will need nutrition. It will need oxygen supply. So how it is getting its supply? So heart is very intelligent. It actually separates the blood from the very beginning. As you all know, heart is a muscular chamber. It pumps blood to different part of the body. While doing so, the blood actually is getting passed through a large pipe, which is known as aorta. So from the first branches of this aorta are known as coronary arteries. So what the coronary artery do? They actually supply the muscle of the heart. So heart actually takes out his own blood supply at the very beginning. And as you all know, there are 3 coronary arteries, 2 on the left side and 1 on the right side. So these coronary arteries, they supply oxygen and nutrient to the heart muscles. Now, if there is some problem in this coronary artery, that means the supply chain of heart muscle, then you do have something called chest pain. And the most fatal consequence of this chest pain is actually heart attack. So what is an heart attack? So heart attack occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or cut off completely. So heart attack is also called myocardial infarction in our cardiologist term, and sometimes this heart attack can be fatal. As Dr. Roy mentioned, heart attack is not a good thing to have. So most of the time, the cause of heart attack is known as atherosclerosis. Atherosclerosis, I don't want to elaborate atherosclerosis. In simple term, atherosclerosis means heart blockage. So heart blockage, does it develop suddenly? Answer is no. Heart attack can actually develop suddenly, but the heart blockage, it actually gradually develops. So what happens? The cholesterol, it gets deposited in the coronary arteries, which is the supply line of the heart. And days after days, gradually this deposition, actually the lumen of the coronary artery, they get narrower. So this process is known as atherosclerosis in scientific terminology, and in layman's term, we call heart blockage. It takes years to develop heart blockage. Now, on top of this heart blockage, if some clot forms and the supply of blood completely stops, that situation is known as heart attack, which is the most fatal outcome of the coronary blockage. Now, how do we recognize heart attack? So to understand the points which indicate the heart attack, we must understand the warning symptom of heart attack or warning symptom of cardiac blockage. Now, as I mentioned, if your chest pain, the classic description I already given to you. Now, if the chest pain is associated with some other features, say for example, some sweating, and the typical character of the chest pain I mentioned, pressure or squeezing, and it actually getting radiated to neck, shoulder, as I already described. And very importantly, if it is associated with shortness of breath, breaking out in cold sweat. So sweating is a very common accompaniment. If it is there along with chest pain, it can indicate heart attack. So feeling unusually tired without any reason, nausea, vomiting. So they all indicate there is something very, very wrong with your heart. So if you have this kind of characteristic chest pain along with this associated thing, you are not supposed to sit on that. Fine, you need to seek medical attention as early as possible, because the heart attack can give rise to some complications. So what are the complications? It can give rise to something called arrhythmia. That means the normal heart rate, it can either lowered, which is known as bradycardia, which is not a good thing to have, because you can have faintness or you can become unconscious, or it can go up again, which is known as tachyarrhythmia. So that is also not good thing to have. Now, sometimes the heart attack can give rise to heart failure. So both of them are not equal or not synonymous. So heart attack, as I already mentioned, is something where the blood supply of your heart muscle is compromised. Now, as a result of that, if the normal function of heart getting deranged, we call it heart failure. So what is the normal function of heart? To receive blood and to pump it out in the different organ of our body. If that particular function is hampered, we call the situation as heart failure. So extreme form of complication of the heart attack is something called heart rupture. So the muscle or the wall can actually rupture, and then there can be bleeding in the chest cavity. There can be associated valve problem in very, very severe kind of heart attack, and in very severe consequences of obviously the mortality or death. So what we are supposed to do? So what if someone gets symptoms which actually indicating that the patient is having, or the person is having heart attack? Because to confirm heart attack, what you are supposed to do, you are supposed to get one ECG, but we do not have ECG facility in our home. So what should we do if we are having this kind of symptom which actually indicating towards an heart attack? So many a time I have seen patients, what they do, because they are having chest pain, and it's become a fashion in all Bengali household to keep on sorbitate tablet. So what they do, they go and take one sorbitate. If the heart pain, chest pain goes fine, otherwise they take another sorbitate tablet, which is completely a wrong thing to do. Why I'm saying so? Because sorbitate, yes, in some of the heart pain or chest pain patient, the pain can be reduced, but sorbitate has a tendency to reduce the blood pressure of the patient, which may not be a good thing to have if you're really having heart attack, because all the chest pain are not heart attack. Fine. So do not go and take one sorbitate without a confirmed diagnosis. This is first thing I would like to say to whoever is listening to this seminar. Don't go and take one sorbitate whenever you are having chest pain. It's a completely a wrong approach. So what is best? You should go to the nearest hospital or nearest facility where one ECG is available, and there is one doctor who can interpret that ECG. Because if you are having heart attack, even the best cardiologist of the world, from your symptom, cannot 100% surety diagnose that this is heart attack without doing an ECG. So it is mandatory to get one ECG. Fine. So that ECG, you cannot read that ECG. So there should be one doctor who can actually read the ECG. And if the doctor says that you are having heart attack, then they will give you some fasted medication, some medicine, which we call loading dose. And after that, you are supposed to come to your nearest cardiac hospital. So if you're not having ECG facility in the vicinity of your neighborhood, and you want to do something in your house, then you can do one thing. If you have aspirin tablet, so that many a time we do have aspirin, which is known as the common brand name is Ecosprin. If you have Ecosprin tablet in your house, you can go and chew 1 or 2 Ecosprin tablet, 75 or 150. You can take up to 300 milligram of Ecosprin tablet. That you can do, because this is not going to harm you. Because even if you are not having heart attack, yes, you can stop it later on. But if you are having heart attack, and in the very beginning you take the aspirin as a chewable tablet, it can save you. Fine, it can save you because it may re-establish the blood flow in your heart if you are actually suffering from heart attacks. Fine, so that is the right way to do. But as I mentioned, it is very important to rush to your nearest medical center to clear the doubt, to clear the confusion. Fine. Now, this coronary artery disease, which is actually a heart disease, as you all know, this is the commonest cause of death across the globe. Even in 2020, around 31% of global deaths were due to heart disease, and most common cause of this heart disease are actually coronary artery disease. The extreme manifestation of coronary artery disease is actually heart attack. Fine. So let us see why heart attack happens, why cardiac blockage it develops. Fine. So first we must understand, as Indian, we are genetically more predisposed to develop heart blockage. Fine. This is because of our gene. And in a rough estimate, we are actually fourfold higher risk of developing heart blockage compared to rest of the world. So we must understand, being Indian actually predispose you of having cardiac issues more commonly compared to rest of the world. Now, why this heart blockage develop? Heart blockage is not a 1:1 causal relationship disease. So what does it mean? It's not like coronavirus disease, or it's not like COVID-19, where one particular virus enters your body and that gives to you some symptom in the form of fever, shortness of breath, etc., etc. And when the virus is dead, you are cured of the disease. So in this kind of situation, there is 1:1 causal relationship. But heart disease, we call it chronic illness. And majority of the chronic illness, they have multifactorial, pathophysiology. That means if there are some risk factors in, conjoined, they will give rise to heart blockage. So basically, this is the manifestation of different risk factor you are having. Out of these different risk factors, some of the risk factor we call non-modifiable, some of the risk factors we call modifiable risk factors. So non-modifiable risk factors, if I give example, then your age. If you are male, when your age is above 45 years, and if you are female, if your age is more than 55 years of age, then age itself become an risk factor. So you are having higher chances of heart disease. Similarly, a male individual is having higher risk compared to a female individual of developing cardiac illness. Similarly, family history. If you are having multiple family members who are involved with cardiac disease at a very young age, then genetically actually you are having higher risk of developing heart disease. Now, problem with this kind of risk factor, that these risk factors are not at your hand. You cannot change them. So they are called non-modifiable, because you cannot control your age. It will grow as the days progress. Similarly, the sex, the family history, you cannot change. So actually, non-modifiable risk factor, we cannot do much. So then comes the modifiable risk factor. I give always more importance to this modifiable risk factor because you can play with them. You can actually change them. What are the modifiable risk factor for developing heart attack or heart blockage? Commonest modifiable risk factors are smoking, diabetes or high blood sugar, hypertension or high blood pressure, obesity, your physical inactivity, consumption of less fruit and vegetable, consumption of more junk food, high consumption of alcohol, cholesterol derangement in your blood. If your blood cholesterol is high, that becomes a risk factor, modifiable risk factor though. Stress. If you are, suffering from stressful, your work patterns requires more stress, then actually you are more susceptible to develop heart blockage. So just briefly discuss about this modifiable risk factor because they are more important than non-modifiable risk factor, because at any point you can actually change this modifiable risk factor. Now, smoking is the commonest modifiable risk factor. So it directly affects the heart, it indirectly affects the heart because it can increase your blood pressure, it can derange your cholesterol level. The good cholesterol, HDL, can go down, LDL can go up, which is bad cholesterol. So it is estimated that smoking increases the risk of stroke and heart blockage by around 100%. So a very bad thing to have. Smoking. Similarly, high blood glucose or diabetes. 80% of diabetics, they die out of heart disease. And risk of sudden death from heart attack for diabetes is same that of someone who already had a heart attack. So diabetes, we call it's cardiac risk equivalent. So someone who already having some heart disease or someone who is diabetic for long duration, their risk of developing future heart attack or future cardiac issues are almost same. So it's not a good thing to have. Similarly, high blood pressure, it can lead to heart blockage, narrowing of blood vessels if it is not properly treated. Similarly, obesity, because nowadays the obesity is actually increasing very fast in our country. There are two patterns of obesity, as you know, something called pear-shaped obesity, where the store of fat is more on hip and thighs, whereas something called apple-shaped obesity, where the stored body fat around abdomen and chest. Which one is actually better? Actually, the pear-shaped obesity is better, because apple-shaped obesity, it indicates more visceral fat deposition. So there is more fat deposition in your vital organs. So we Indian actually suffering more commonly with this apple-shaped obesity. Alcohol in large quantity, it adds fats, it adds calories, and it can increase the blood pressure. So consistent alcohol consumption in large quantity can facilitate fat deposition and fasten the process of development of heart blockage. Fine. So alcohol is a very important source of extra calorie consumption. So direct relation with alcohol with heart is not that strong, but indirect relation with alcohol is very, very strong. Should think about it. Cholesterol imbalance, I already mentioned. There are two types of cholesterol. One is known as LDL, which is bad cholesterol. Another is known as HDL, or good cholesterol. If your good cholesterol is high and bad cholesterol, LDL, is low, then it is a good thing to have. But mostly in individual, particularly who are diabetic or who are having other risk factors, who are smokers, the LDL goes up. Genetically also, the cholesterol metabolism derangement can be there. Some of the individual, they have heart attack at a very young age because of this derangement in this cholesterol. Their LDL cholesterol or the bad cholesterol is very, very high. So if you are having it, you should pay proper attention. Now comes the stress, because as you all know, stress can cause people to adapt poor habits like smoking, eating badly, which can increase your body weight. In turn, they can give rise to heart blockage. So stress is not a good thing to have. Now, very importantly, what is true about this modifiable risk factor is the aggregation of risk factor. Now, risk is it multiplicates when many risk factors coexist. So the risk factor often they cluster together. So 1 + 1 risk factor result may not be 2. It can be 3, 4, or 5, or something like that. So if you are diabetic, then you should pay more attention if your blood pressure goes up. Fine, because if they are present together, the consequences can be more fatal compared to each of them presenting, as an individual risk factor. All this risk factor I told you. So should I lose hope having many risk factors? If you are diabetic, if you are hypertensive, if your cholesterol is not good, if you are obese, should you lose hope? Answer is very much no. Why? Because this heart blockage, the good part about the story is the heart blockage, it is actually preventable. So there was a huge study, I'm not going into details, known as Inter-Heart study. It was performed across the globe, started from America, but the individuals were taken from 52 countries with 30,000 individuals. They studied and they found that conventional, easily measurable and potentially modifiable risk factor, they actually account for most of the risk. That is more than 90% of risk for having a heart attack. Fine. So most premature cases of myocardial infarction or heart attack actually are preventable. So how we can do it? How we can prevent heart attack? How we can prevent having heart blockage? So let us discuss about that. So what we need to do, we need to get a right information about the risk factor. As I already mentioned, the modifiable risk factor are more important to us than the non-modifiable risk factor. So if we take proper attention about these modifiable risk factors, then in most of the cases, we can actually prevent heart attack. So it is said that prevention is always better than cure. So I have 9-step approach for you people to follow, by which you can probably prevent more than 90% of cases of your heart attack or heart blockage. So what are those 9 steps? Very simple. You can remember this. Step number 1, quit smoking. Step number 2, control diabetes. If you are diabetic, take proper care of your blood sugar. Control of blood pressure is this third advice. Third step, maintain healthy body weight. BMI less than 25. I'll briefly discuss about all this in my subsequent slide. Fifth advice is exercise regularly. 5, 6 is consume more fruits, more vegetables. 7, refrain or reduce alcohol intake. 8 is maintain healthy cholesterol level. And 9 is obviously to avoid stress. So I just briefly talk 1 or 2 lines about these 9 steps. Smoking, as I mentioned, it is probably the worst habit people actually adopt. So your goal should to stop smoking altogether. It doesn't help if you reduce it. So you need to stop it altogether. So you need to consult your doctor for best ways to quit smoking. Use nicotine patch if it is prescribed. If your doctor says use some help, you can take. And very importantly, it is very easy to stop smoking, but they again restart. So very important to make your mental stamina. Don't give up. Fine. Second step is definitely control of diabetes. There are some non-pharmacological treatments, some lifestyle modification, and majority of the cases you need medicine for your blood sugar. Go to a diabetologist, go to your physician, take medicine, and don't stop them, because till date, we do not have anything to cure your cholesterol, to cure your blood pressure, to cure your diabetes. If you are having this, it is best to control them, because if you do not control, they are asymptomatic disease. They do not produce any symptom. They do not cause chest pain. They do not cause any other symptom, but they actually keep on damaging your vital organs. Not only heart, all the organs in your body, actually it's getting some sort of damage. So it is very, very wise to keep this risk factor under control, and diabetes is one of the most important risk factor. Similarly, blood pressure, it is very important. If you are hypertensive and your blood pressure is actually above the goal, in spite of appropriate lifestyle measure, say for example, you have stopped smoking, you do regular exercise, your salt intake you have reduced, still if it is high, then take medicine and do not stop that medicine. Many a time people think that I need to take this medicine up for 1 month or 2 months and my blood pressure becomes normal, now I can stop it. It is not going to happen. This is something you need to continue until and unless the doctor advises to do something else. Body weight, your ideal BMI. What is BMI? BMI is your body weight in kg divided by height in meter square. So it should be less than 25. We call it, ideal BMI should be 18.5 to 25. So how you are going to do it? Yes, reduce your fat intake, reduce your carbohydrate intake in appropriate way. Do not overeat. Many a time we take food when you are not hungry. Do not do that. Have smaller portions of food. Be physically active. Use stairs. And do not use lifts. Say, for example, in your work, always try to use stairs. In your way to work, do not take rickshaw all the time. Go, by walking. So in your day-to-day activity also, you can incorporate the physical exertion. So that helps. Exercise regularly, 150 minutes of brisk walking or moderate physical activity. That's all you need to do. If you can do that, so 30 minutes a day, 5 days a week. Yes, you might have some important, engagement in 2 days in a week, but you should do it at least in 5 days a week. So that can actually helpful in a large way. It can reduce your heart blockage chances by about 30%. So very simple measure, you can take that. So consume more fruits and vegetable. Variety of fruits, mostly colored vegetable, are very, very good. 5 servings per day, and variety of grain products. That is also very good thing to have. Refrain and reduce alcohol. I already mentioned, if you are alcoholic, try to reduce it. Fine. Do not, if you are male, do not take more than 2 drinks per day. If you are female, do not take more than 1 drink per day. 1 drink means 45 ml, not 60 ml. Fine. So that actually helps in many direct as well as indirect way. So healthy cholesterol, as I already mentioned, LDL is your bad cholesterol. HDL or high density lipoprotein is your good cholesterol. How you can increase HDL? There is no medicine to increase HDL. Only way you can increase HDL by doing regular physical exercise. And if you are a smoker, if you stop smoking, then your HDL goes up. Now, there is some controversy regarding LDL because nowadays we know that your LDL is actually, it does not depend on your food habit. Actually, it is genetically determined. That means your cholesterol, it is determined by your gene. So if you are really having high cholesterol, that is high LDL cholesterol, then you should take medicine for that. If you reduce your dietary cholesterol, it may not be translated to your low blood cholesterol. So that thing we must understand very clearly. So avoid stress, follow your hobbies, interests, take holidays to get away from routine, try various meditation technique, yoga, pranayam, all these things actually helps. And to conclude, I think I discussed now for quite a good time. So to conclude, understand warning signs of heart attack, respond in time, do not go and take sorbitate for all your chest pain, prevent heart attack by adopting healthy lifestyle, staying fit. Prevention is always better than cure. Good health can't wait. So if I just give you the take-home message regarding your chest pain, the characteristic of your chest pain frequently tells you whether it's a sign of heart attack or something else. I already mentioned what is the typical pattern. Take a deep breath, analyze your symptom, and act accordingly rather than doing some panic. An important note though, never assume chest pain is nothing to worry about. Given the life-threatening potential of a heart attack, any chest pain deserves attention. And whenever you are in doubt, please seek medical advice, because if you are really having heart attack, then it's very important to understand the importance of time. So earlier your treatment start, better is the long-term consequences. So with that, I think I should stop here, and the session is actually open for discussion. Thank you very much.
Thank you, Arindam. Now, that was a very good presentation. I'm sure I'll come back to you when I'm concluding it. What I want to hear, that somebody who already had a heart attack and who's familiar with the cardiac pain or heart pain, what is your experience? How often they avoid their cardiac pain, or they live with the pain, or do they get alarmed every time they get a pain? So what is your experience about those who had a heart attack and still having chest pain and not doing anything about it?
So, sir, it's a very relevant point you raised. So why we are having chest pain? We must understand that clearly. So chest pain is basically cry of your dying heart muscle. So it's not important to reduce the chest pain by some medication or some other technique. If you are having chest pain, actually it is your heart muscle which is crying. Actually, your heart muscle is telling you, go and seek something, do something. So the reason I'm having this chest pain, it actually taken care of. So your blood supply to the muscle, heart muscle, is getting compromised. So that is why you are having chest pain. And commonly what happens, it is very common practice, we curtail our activity. So because heart pain, it increases whenever we do activity, we walk around. So what the patient do, they actually gradually stop walking. And it happens more commonly after you take some meal, postprandial chest pain we call. So they do not do anything after taking food, because they know that if I walk around after consuming some heavy meal, I'll start having chest pain. So by doing that, they actually gradually reduce their physical activity. And by doing that, their body weight goes up. So this is a way how they manage it. They do not do it intentionally, but this is a very common practice. And other group of people, they go and seek their physician, they give them anti-anginal medication. Initially 1, then gradually they make it 2, then 3, 4, 5. I have seen many patients who are having very serious cardiac blockage. They're taking 5, 6, 7, 8 medicine to relieve the chest pain, but they are not doing anything to get it corrected from inside. So what happens, at one hand, they experience the side effect of the medicine, and another hand, as the heart actually, many of the chest pain indicates your heart muscles are dying, so their cardiac pumping gradually comes down. So it is always recommended, if you are really having chest pain, which you are sure that it is a cardiac chest pain, you should go and try to evaluate the reason behind it and get it corrected, because nowadays very, very modern therapies are available to actually understand the root cause of chest pain and correct it.
Dr. Pande, what you are saying, that what I'm understanding, that if you had a heart attack and you are having chest pain, that does not mean that you should sit over it. You must consult a doctor and you must live a life of chest pain free, which is cardiac origin. Is that what you are saying?
Yes, sir. Absolutely.
Now tell me, what is stable angina and how is it different from heart attack?
Yes, a very, very important question. You're asking all very important question today. So as I mentioned, the heart attack, it can develop suddenly, but the heart blockage, it does not develop over hours. It takes time, because how the heart blockage develop, gradually the cholesterol are actually getting deposited in your heart vessel, which supply blood to your heart, and the lumen is gradually getting narrower. So in this stage, you are not having heart attack, because heart attack means the blood supply is completely either cut off or very, very compromised. But at this stage, normal flow of blood is compromised gradually. So what happens in this stage, you are not having heart attack, but you are having heart blockage. So this is a state where we call it stable angina. Now, stable angina itself is a misnomer, because this state is not stable. Nowadays, the terminology as per the different bodies, say for example, European Society of Cardiology, American College of Cardiology, they have changed the terminology. They no longer call it stable angina. They are now calling it chronic coronary syndrome. So nowadays we have two extreme of heart disease manifestation. At one hand, we do have acute coronary syndrome, which includes heart attack, and on other hand, we are having chronic coronary syndrome, where the blood flow is still there, but the lumen of your coronary arteries are getting gradually compromised. The lumen is getting narrower day by day, because more and more cholesterol is actually getting deposited. So in this stage, you have symptom of chest pain while you are doing some activity. You are doing more than normal activity, you will have chest pain. So you will gradually curtail that. Then you start having activity, chest pain even at normal activity. So that indicates your heart blockage is gradually increasing. Then at one point, you will have chest pain even below normal activity. So this phase is known previously as stable coronary artery disease or stable angina. Now we call chronic coronary syndrome, but they can turn into acute coronary syndrome at any point of time. So ideally, you should seek medical advice at this stage only.
So you are saying there's nothing like stable angina. Any chest pain must be addressed. Right?
Yes.
Doctor, a lot of patients I know of, they pass on they don't get really pain. They get other symptoms, especially in diabetic, I was told. So what do you say? What is your opinion about that? That patient not getting chest pain, but is having heart attack. How do you identify it? How do my friends identify it at home? They are having a heart attack, but not having any pain.
Yes, this is very common. One, already you mentioned about diabetic individual. Another is a little elderly person. So in little elderly person and in diabetic, it is not uncommon that you do have heart attack without any chest pain. Why it happens? Because in diabetes, what happens, as I mentioned, diabetes is like slow poison. Fine, it damages all the organs of your body. So similarly, it damages the nerves. So how we feel heart chest pain, because the nerve fiber, they transmit the sensation of pain from heart, and thus we understand that you are having some problem in your heart. But think that your nerves are already damaged by diabetes, high sugar, so you will not feel chest pain. So this kind of patient who already have heart attack without chest pain, they present with other symptoms. Because if you have heart attack, then you could not recognize the incidence, then next step is heart failure. So your cardiac pumping comes down. So they will have symptoms of shortness of breath. It's very common. They do not have chest pain, but they do have other symptoms. And commonest symptom is shortness of breath or easily having dyspnea. So shortness of breath, another very important symptom in this group of patients is easy fatigability. So they get tired with very, very ordinary activity. which they used to do previously very comfortably. Now they get tired. We call it fatigability or easy fatigability. Then there can be something called unexplained sweating. You are having sort of, abdominal discomfort. Many times there is no abdominal discomfort even, only unexplained sweating, sense of feeling impending doom. These are some presentation which can come without chest pain, and in some particular group of individual, particularly in diabetic individual or in extreme of age, very elderly individual, they actually can indicate heart attack.
Thank you. So what Dr. Arindam Pande is saying, that many times you don't get a heart attack, you just can't breathe. You feel that there's not enough oxygen in my mouth or lungs. So you say, open the windows. Hawa nahi aa rahi hai. Hawa lao, AC chalao, thanda karo, I can't breathe. So Dr. Pande is saying that those are also signs of heart attack. That means that heart is not able to pump. So the blood is getting into the lungs. So lungs are not able to breathe, and you feel shortness of breath in doctor's language, layman's language, कि हवा नहीं जा रही है, मैं सांस नहीं ले पा रहा हूँ डॉक्टर साहब, I can't breathe. Both are equally serious. In fact, shortness of breath is far more serious than that means the heart has already failed or going toward the failure seriously. डॉक्टर साहब एक और बड़ा छोटा सा प्रश्न आपसे कि ये बहुत से लोग हार्ट पेन को हाइपर एसिडिटी कह के टालते रहते हैं बहुत दिन तक, और कई लोगों को वाकई चेस्ट पेन जो है हाइपर एसिडिटी से होता है, जब पेट में गैस और हाइपर एसिडिटी. सो हाउ डू यू डिफरेंशिएट दैट दिस इज हाइपर एसिडिटी और इज रियली हार्ट अटैक?
So there are some pointers I'll briefly mention, but the tagline will be, until and unless you do some proper investigation to see whether your heart is normal or not, you do ECG, echo or some other investigation. Many times it may not be possible to differentiate between those two. So ऐसा हो सकता है कि आपको समझ में नहीं आ पाए, लेकिन कुछ पॉइंटर है जिसमें आप कह सकते हो कि ये सब रहेगा along with your acidity or dyspepsia, तो ये हार्ट से origin हो सकता है. So commonly if your symptom of acidity, it comes with activity. So ये कैसा एसिडिटी है जो नॉर्मली आप बैठे रहते हैं तो नहीं होता है, आप चलना शुरू करते हो, पर्टिकुलरली सीढ़ी वीढ़ी चढ़ते हो, तब आपका एसिडिटी होता है, फिर आप बैठ जाते हो तब आपका एसिडिटी ठीक हो जाता है. अगर आपको एक पैटर्न ऑफ एसिडिटी है, देन आई एम श्योर इट इज नॉट एसिडिटी, दिस इज समथिंग सीरियस with your heart. Similarly, एसिडिटी के साथ अगर आपका अनएक्सप्लेन्ड स्वेटिंग होता है, आपका एसिडिटी बहुत हुआ है, साथ में आपको बहुत स्वेटिंग हो रहा है, ऐसा एसिडिटी नहीं होता है जिसमें आपका स्वेटिंग शुरू हो जाता है, या एसिडिटी के साथ आपका सांस फूल रहा है, या आपका सिर में चक्कर आ रहा है, थोड़ा आंख में आप धुंधला दिख रहे हो. सो ये सब अगर रहेगा आपका एसिडिटी के साथ, तब आपको ये समझना पड़ेगा कि normally acidity do not give rise to these additional symptoms. And very importantly, if your acidity symptoms are related to exertion, then you can be sure that this is not simple acidity, this is actually an heart attack or something serious with your heart.
Doctor, many times I hear that patients went to the bathroom and collapsed, and out of 10, 5 times they collapsed in the bathroom. What is the relationship of bathroom and chest pain or heart attack?
Actually, sir, क्या होता है? There is something called diurnal variation of blood pressure. हम लोग का जो ब्लड प्रेशर होता है, ये सारा दिन में फिक्स नहीं रहता है, ये वैरी करता रहता है. सुबह में एक टाइप का ब्लड प्रेशर होगा, रात में एक टाइप का, शाम को एक टाइप का ब्लड प्रेशर होगा. तो इसमें देखा गया है, there is something called early morning blood pressure surge, अर्ली मॉर्निंग बीपी सर्ज. आप जब सो जाते हैं तो इनिशियली आपका ब्लड प्रेशर बहुत नीचे आ जाता है धीरे धीरे, वी कॉल इट नॉक्टर्नल डिप. देन से फॉर एग्जांपल इन मिडनाइट 2 बजे 3 बजे बहुत नीचे आ जाता है, फिर 4 बजे 5 बजे सुबह में आपका ब्लड प्रेशर फिर से ऊपर चढ़ना शुरू हो जाता है. दिस इज मोर एक्सटेंसिवली सीन इन हाइपरटेंसिव इंडिविजुअल. आपका अगर ब्लड प्रेशर का बीमारी है तो ये जो अर्ली मॉर्निंग आपका ब्लड प्रेशर चढ़ना शुरू होता है वो बहुत ज्यादा हो सकता है. इनफैक्ट आपका सारा दिन का जो ब्लड प्रेशर है वो सबसे ज्यादा ये अर्ली मॉर्निंग बीपी सर्ज के टाइम में आपका होगा. तो ये टाइम में आप अगर उठते हो, आप बाथरूम जाते हो, या आप कोई किसी किसी का है कि वो मॉर्निंग वॉक करता है सुबह में, पर्टिकुलरली विंटर सीजन में आप मॉर्निंग वॉक करते हो, क्या होता है विंटर में योर ब्लड प्रेशर गेट्स कॉन्स्ट्रिक्टेड, सो दैट ऑल्सो इंक्रीजेस द ब्लड प्रेशर. So suddenly blood pressure is early morning में इतना ज्यादा हो जाता है, it can precipitate either stroke, fine, brain stroke or heart attack due to this high blood pressure in the very early morning. इसीलिए हम लोग जो हार्ट का डॉक्टर है, हम लोग अभी एडवाइस करते हैं भाई आपका अगर हार्ट का बीमारी है या अगर आपका ब्लड प्रेशर ज्यादा है उसके लिए आप मेडिसिन लेते हो, तो आपको अर्ली मॉर्निंग वॉक नहीं करना चाहिए. आपको अगर मॉर्निंग वॉक करना है थोड़ा लेट में जाओ, 7 बजे के बाद जाओ, नहीं तो आप इवनिंग वॉक करो. नहीं तो हम लोग देखें मॉर्निंग वॉक करने के टाइम में बहुत लोगों का हार्ट अटैक हो जाता है, स्ट्रोक हो जाता है. सो दिस इज बेसिकली द रीजन अर्ली मॉर्निंग में क्यों होता है ये.
थैंक यू डॉक्टर साहब. डॉक्टर साहब, पेसमेकर का कोई रोल है हार्ट अटैक में?
हार्ट अटैक में
क्वेश्चन फ्रॉम द
पेसमेकर
ऑडियंस.
there are actually two things. I also saw the question in chat box. तो पेसमेकर जनरली हम लोग लगाते हैं जब आपका हार्ट रेट फॉल कर जाता है. तो क्या होता है, एक पैटर्न का हार्ट अटैक होता है जिसको हम लोग बोलते हैं इंफीरियर वॉल मायोकार्डियल इंफार्क्शन, जिसमें क्या होता है आपका हार्ट अटैक के चलते हुए आपका हार्ट का इलेक्ट्रिक सर्किट में ब्लॉक भी आ जाता है. तो उसको हम लोग जब ट्रीट करते हैं, हम लोग जब एंजियोप्लास्टी के लिए लेते हैं पेशेंट, या कभी भी अगर हॉस्पिटल में आ जाता है, तो हम लोग जब देखते हैं कि हार्ट रेट बहुत आपका फॉल कर गया, तो हम लोग एक चीज करते हैं, उसको बोला जाता है टेम्पोररी पेसमेकर इम्प्लांटेशन. तो टेम्पोररली गिव द सपोर्ट टू द हार्ट टू इंक्रीज द हार्ट रेट, देन वी करेक्ट द बेसिक प्रॉब्लम. हम लोग उसको प्राइमरी एंजियोप्लास्टी कर देते हैं, या जो भी उसका हार्ट का नस है जो बंद पड़ा हुआ था उसका ब्लड खोल देते हैं, तब क्या होता है हार्ट रेट वापस आ जाता है. लेकिन ड्यूरिंग दिस पीरियड वी नीड सपोर्ट ऑफ टेम्पोररी पेसमेकर. ये एक तरह का सपोर्ट है पेसमेकर का, हार्ट अटैक में रोल ऑफ पेसमेकर. लेकिन ये परमानेंट पेसमेकर नहीं लगता है, बाद में हम लोग टेम्पोररी पेसमेकर रिमूव कर देते हैं. सेकेंड जो रोल हो सकता है हार्ट अटैक में, क्या होता है कभी कभी अगर आप बहुत देर से हॉस्पिटल आते हो, यू कम टू हॉस्पिटल, रीच हॉस्पिटल वेरी लेट, एंड बाय दैट टाइम वेरी सिग्निफिकेंट डैमेज टू योर हार्ट मसल हैज ऑलरेडी हैपेंड, then your cardiac pumping comes down. If your cardiac pumping comes down, and we see some other additional criteria in the ECG, we call it left bundle branch block. So your ejection fraction, which is a measure of cardiac pumping, it is below less than 35%. Normally it should be 60 or more, 60% or more. And at the same time, your low ejection fraction, if you have ECG criteria of left bundle branch block, ये सब सिचुएशन में आफ्टर अराउंड 1.5 महीना का बाद अगर आपका पंपिंग इंप्रूव नहीं करता है, तो हम लोग एक स्पेशल पेसमेकर लगाते हैं, उसको बोलते हैं कार्डियक रिसिंक्रोनाइजेशन थेरेपी, CRT. ये नॉर्मल पेसमेकर जैसा नहीं है, इसमें 3 लीड रहता है, हम इसको ट्रिपल चेम्बर पेसमेकर बोलते हैं. ये लगाने से आपका हार्ट का पंपिंग जो कम हो गया था वो वापस नॉर्मल हो सकता है, इंप्रूव कर सकता है. सो दीज आर द 2 वे अ पेसमेकर कैन हेल्प इन हार्ट अटैक पेशेंट्स. नॉर्मली हार्ट अटैक का ट्रीटमेंट पेसमेकर नहीं होता है. इलेक्ट्रिक ब्लॉकेज जो होता है, जिसमें जो कोलैप्स कर जाता है पेशेंट, सिंकोप होता है, बेहोश हो जाता है, उसके ट्रीटमेंट में हम लोग पेसमेकर लगाते हैं, लेकिन वो एक्चुअली हार्ट अटैक नहीं इंडिकेट करता है.
Thank you, Dr. I mean, you all will agree that Dr. Arindam Pande has done a fabulous job of explaining so lucidly. And some of the points which he mentioned, I'd like to repeat it for you all to take home and remember that all pains are not chest pain, not cardiac pain. He says, if you can pinpoint your pain, अगर आपने अपने दर्द पे उंगली रख दी तो दर्द आपका कार्डियक नहीं है, ये कह रहे हैं. और ये भी कह रहे हैं कि कई बार होता है गैस्ट्राइटिस से आपको गैस से पेन हो, तो गैस का पेन जो है वो हर समय होता है, ये नहीं खाली चलने पे होता है. तो अगर चलने में पेन होता है गैस का, तो गैस का पेन नहीं, वो हार्ट का पेन है. और उन्होंने ये भी कहा कि जब आपको हार्ट पेन या हार्ट अटैक के साथ लग रहा हो तो सॉर्बिटेट मत खाइए, बहुत कॉमन मिस्टेक है. दिस कैन वर्क अगेंस्ट यू. अगर आपको लेना ही है या अगर आपको लेना चाहिए, अगर आपको लग रहा है ये कार्डियक पेन हो सकता है, तो अप टू 300 मिलीग्राम सॉर्बिट ये एस्पिरिन की गोली ले लीजिए. अगर आप घर में इको एस्पिरिन नहीं है, घर में एस्पिरिन है, उसी को पानी में डाल के पी लीजिए. अगर वही आप पानी में डाल के पी लेंगे या चबा लेंगे तो उससे आपका हार्ट अटैक हो सकता है रुक जाए. Dr. Saab, you will confirm me that lot of other methods of doing it, but we don't want to tell you about all that. Now, इन्होंने कहा कि 2 चीजें बड़ी साफ साफ कही, कुछ मॉडिफाइबल रिस्क है, कुछ नॉन मॉडिफाइबल है. आपका एज, आपका सेक्स, आपका फैमिली हिस्ट्री नॉन मॉडिफाइबल है. आप अपने माँ बाप को कैसे बदलोगे? You can't stop your age. These are non-modifiable. लेकिन modifiable risk factor, he gave a huge list, and it was very interesting that पिछले 4 हफ्ते से हमने हर आदमी ने कहा, जब हमने बात की ब्रेन स्ट्रोक के बारे में, डॉक्टर हर्ष जैन ने कहा कि स्मोकिंग इज द बिगेस्ट फैक्टर. जब हमने कहा विंटर एंड लंग्स, तो डॉक्टर साहब ने कहा हमारे कि जो है सबसे बड़ा फैक्टर, डॉक्टर अर्नब जैन ने कहा कि इज द स्मोकिंग. नाउ डॉक्टर पांडे कह रहे हैं सबसे बड़ा स्मोकिंग इज वन ऑफ द बिगेस्ट फैक्टर, एंड दैट शोज वेरी क्लियरली कि स्मोकिंग तो बंद कर दीजिए महाराज, चाहे कुछ करिए मत करिए, stop smoking. And if somebody smokes in your house, please go after his life, make his life miserable, and make sure he doesn't smoke, because he's not only hurting you himself, he's hurting everybody else in the family. He's certainly a sinner and must be stopped. I'm using a very strong word, please forgive me for that, but it's your life after all. इन्होंने ऐसे भी कहा कि कोई अगर आपको चेस्ट की प्रॉब्लम है, हार्ट अटैक की प्रॉब्लम है, घबराइए नहीं. उन्होंने कहा कि ये तो आप बच सकते हैं, इसे ठीक हो सकते हैं अगर आप अपने को मॉडिफाई करें. इन्होंने क्या कहा? इट्स प्रिवेंटेबल, क्विट स्मोकिंग. कहा कंट्रोल डायबिटीज. अरे भाई गोली 4 गोली खाने में, इंसुलिन लेने में क्या बुराई है? उन्होंने कहा अपना ब्लड प्रेशर कंट्रोल रखिए, 120/80 के नीचे रखिए. इन्होंने कहा अपना वेट कम करिए, जो एप्पल जो इतना बड़ा पेट निकला उसको कम करिए, उससे जो है आपका रिस्क बढ़ रहा है. इन्होंने कहा कि एक्सरसाइज रेगुलरली करिए. 30 मिनट एक्सरसाइज हर रोज करेंगे, हफ्ते में 5 दिन, तो आपका हार्ट अटैक का चांसेस 30% गिर जाएगा. सोचिए कितना बड़ा सपोर्ट है रोज का एक्सरसाइज. खाली चलना ही तो है, कितना मुश्किल है. इन्होंने चलने के साथ ये भी कहा कि डोंट गो आउट इन द विंटर इन द कोल्ड एयर, गो लिटिल लेटर व्हेन इट गेट्स वार्म्ड अप सो यू डोंट गेट हार्ट अटैक. इन्होंने कहा कि फ्रूट्स एंड वेजिटेबल. लास्ट टाइम डॉक्टर हर्ष जैन ने भी कहा था कि होल फूड प्लांट बेस्ड डाइट इज द बेस्ट डाइट फॉर ब्रेन स्ट्रोक, प्रिवेंटिंग ब्रेन स्ट्रोक. डॉक्टर अरिंदम पांडे हमारे कंसल्टेंट कार्डियोलॉजिस्ट अगेन सेज द सेम थिंग कि भाई सब्जी खाइए, फ्रूट्स खाइए, 5 colored vegetables खाइए. I don't think we can overemphasize on that how the plant-based nutrition is far better than the non-veg, which we take so much of pride in. Alcohol, obviously, and stress is one thing which you must control. I think we already overshot our time. I'm extremely thankful to Bengal Chamber of Commerce and Industries for supporting us, and of course, Rotary Club of Calcutta, Aviana, for supporting us and taking the message to you all. We don't want you to get treated in our hospital. We want you not to come to the hospital. But God forbid, if you do it, probably if you get a heart attack, God forbid, we are always there. And Medica, wherever Medica is, always prepared. The moment patient reports with a heart attack, within 30 minutes, he's in the cath lab. There's a question, there's no cath lab in some of the hospitals. There are various medicines available which can abort heart attack. So don't have to worry about it is no cath lab. So please stay well, stay healthy. We'll pray for your health, good health, and most of it, more than my prayer, it is in your hand. Take your health in your hand. We'll tell you how to do it. Thank you very much. Have a great weekend. Namaste. Thank you, Dr. Arindam. Thank you very much.
Most welcome.
Thank you.
Most welcome.
Thank you. Thank you.